So, with the health service facing its toughest winter yet and staff under severe pressure, one top doctor is suggesting a 7-day week to clear the record backlog. Well, joining us now to discuss this, Dr. Farzana Hussain, who thinks a full working week is the only way forward, and Dr. Chinne Gwando, who is a consultant urological surgeon and says it's an impossible idea that'll affect both patients and staff badly. Very good morning to you both.
Morning, both.
Morning.
Dr. Chinne Gwando, you are a surgeon. What happens in your working week? If I needed your services at the weekend, would you be available?
Some weekends I would be, because I'm on call. So there's 7 of us, and we do 1 weekend in 7 each.
Right, but but Monday to Friday, are you on call or are you on site?
No, I'm on site.
OK, so that's the difference, isn't it?
It is.
That if somebody needs your services urgently, that might not be something that they plan within a Monday to Friday working rota. Why can't people like you perhaps be paid a little bit more to encourage you to work a full 7-day rota?
Well, as consultants, we are contracted to do our 40 hours a week. So if that happens Monday to Friday, then it means that Saturday and Sunday I wouldn't be on call.
Well, why couldn't you re-roster? For example, like, as I said earlier, like supermarket staff, you simply re-roster. So you might have slightly fewer staff on day to day, but you spread them over 7 days rather than focusing them on 5 days a week. That
can be done, and in fact, that is what we do, and that is what the on-call system is about. So if I'm
but you're not on site. I mean, this doctor who's called for this has actually described his own hospital as looking like the Mary Celeste by about 4 o'clock on a Friday afternoon, because everyone's gone home and preparing to play golf for the weekend, you know?
That's not the case in my hospital.
Isn't it?
I must say.
Yeah, but the thing is, you've already said that you're not on site at the weekend, you're on call. So if people like you aren't on site, then it is going to look a little understaffed. And the trouble is, I think a lot of people have got in their mind this idea that there is a weekend effect. People admitted to hospitals on Saturday or Sunday are more likely to die than those admitted Monday to Friday. It's assumed extra deaths occur because fewer hospital consultants are present at weekends than during the week. Do you think that it is a fact that people are still cared for properly if you're on call rather than on site?
I think people are cared for properly because, for example, if I'm off site and there's an issue, then I would be called in to deal with that problem.
The delay that comes with that call out, does that not contribute to a delay in care?
I don't think it does, because our junior doctors, our registrars, are highly experienced and they know what they're doing.
All right.
And so they call us in as needs be. OK,
well, let's turn to you, Dr. Hussain. How would it work?
So, if we think about primary care, I'm a GP. Since this October, we've been doing that nationally anyway now. So every single GP practice club together, we offer Saturday appointments 9 to 5. Just to clarify that we're talking about routine appointments. So the NHS is already a 24/7 service for emergency care, but we're talking about those routine appointments. So general practice is doing that. And I think while we've got 7 million people waiting for their clinic appointments at the moment, I think the only way forward is to have a 7-day service.
And that would work, presumably, as I said, on a roster, a rota basis. So, for example, you might have a Tuesday and a Wednesday off if you were working on a Friday, a Saturday and a Sunday.
I think so. If we think about what Dr. Stein was saying in the Telegraph article, with looking at on a Wednesday there's 86 consultants in hospital, on a Sunday there's 12. So can we think about remodelling that? I would be the first to say that there's a workforce shortage. I haven't got any easy answers on this.
This will appear to make worse, because if you spread it over the 7 days, as I said, you'll have fewer people on each day compared to that.
Undoubtedly, and I think that's something we absolutely need to address, that there isn't enough workforce.
So we can't do this before we employ more people?
So I think we need to do it together, because one of my issues is that seeing people on the preventive side in primary care. So a quick example, I've got a patient waiting for a cataract operation. He's a completely well person, but he can't see. He lives on his own. I'm just hoping that my prediction's going to be wrong, but he might fall over because he can't see, and then he'll end up as an emergency anyway.
OK, so he's waiting for a surgeon to be able to carry out that operation.
For a routine operation for his eyes.
And that surgeon, or that department, presumably their hours as surgeons are Monday to Friday, but at weekends on call. It's a similar situation to our surgeon in
there are some waiting list initiatives, so there are some routine clinics on a Saturday and Sunday, but as far as I'm aware, that's not an everyday thing, and that's what I would like to see.
Would you both accept that maybe the resistance to this, your resistance, and it's shared by quite a few NHS staff as well, is because we have in this country a kind of a tradition of a weekend culture? I mean, I'm old enough to remember when all the shops were closed on a Sunday. You couldn't go shopping on a Sunday. You certainly couldn't go to a supermarket. That's all changed. Don't you think the NHS is lagging behind a bit in that cultural shift?
Possibly, but I think it does come down to the workforce at the end of the day.
Would you be OK then? Would you be happy to see this if the NHS employed more people? Say in a couple of years you got the staffing levels up. Would you then be happy to give it a go?
I would.
Would you?
Yeah, yeah, absolutely would.
Well, that's a compromise, isn't it?
So it's not just the doctors you need. You need all the nurses, you need the physios, you need the X-ray services to be working, the pathology labs to be working. So I think it's more to it than just the doctors.
And I don't know what the waiting list is like for your surgery at your health trust, but if you're on call at the weekends, then presumably surgery is not scheduled for you at the weekend. Is that the case?
Well,
I mean, you know, the waiting list could be cut by the equivalent of those 2 days, couldn't it?
So in fact, at my trust, we are operating every Saturday. So we are doing that already. So I guess you would call it overtime. So every single Saturday, we are doing clinics and we are doing operations as overtime. Just
but you're not booked every weekend to do surgery.
If I wanted to be, I could be, but I need some downtime as well.
Of course you do.
Yeah, so the answer is more staff.
Definitely.
And the key to getting more staff is...
Well, what is the key to getting more staff? We've had an underfunded NHS for 12 years. People are walking out. We've got to really shoot with pensions. I'm hoping Steve Barclay's watching. These are things that really need to be sorted out. We are treating our NHS staff like dirt. Nurses are going to food banks. So these are real issues. It's more than just the pay. We need to treat our NHS staff with some respect.
Quick yes or no from both of you. Should the nurses get 17%? Yes or no?
I think that's a tough call.
All right, you'll pass. Yes or no?
I don't know about the 17%. I don't know if that's affordable as a country, but they should definitely get a rise. Yeah.
Okay.
Yeah. All right.
All right. Thank you both very much indeed.
Thank you very much.
Thank you.